Thinking of how to improve your stroke care services? Too many barriers? Let's see how a partnership with Medtronic could help you. Imagine that each year you are admitting 1,200 ischemic stroke patients in your comprehensive stroke center. However, your reperfusion treatment rates is only 5% and your mean door-to-puncture time is 120 minutes. You have identified that the key barriers preventing you to achieve your goals are: protocols and the monitoring process are not optimal. You face difficulties with image processing and clinical decision-making. You deal with restricted access to materials and medications for treatments. You need more staff to cover the 24/7 service for reperfusion treatments. You are convinced that by sorting these issues, you will be able to improve care to meet your optimal results. But it has been difficult to get the backing of the decision makers to obtain the funding to implement your developing stroke care program. Through partnerships, Medtronic can support you to develop your business case in order to facilitate the budget allocation for your development program. We will use the Stroke Care Economix tool that provides a framework in which you will be able to assess the patient's benefit and the cost implications of your development program. Let's check what we could model in this case. Your plan to improve the protocols and ensure that these are implemented consistently will require a consultancy and training. However, you can save valuable time from door to puncture, let's say 20 minutes, that can be beneficial for your patient's health outcomes. To optimize image processing and facilitate the clinical decision-making, you may decide to include innovative technologies into your process. This will result in 20 minutes saved and the subsequent impact on patients' outcomes and 15% of increase in the number of patients being treated with reperfusion treatments, as it's easier to identify them. Besides, you can include the additional INR to cover appropriately the 24/7 service for reperfusion treatments. Using a collaborative process of data collection, considering all the required resources for your program and simulations of several development scenarios, you will be able to estimate, for example, the effect of an overall saving of 50 minutes and the impact of your program on the potential number of patients treated, the proportion of patients achieving functional independency, and the respective costs for your hospital and the healthcare system in the short, mid, and long term. With that information, we can build your business case together and find the best strategies for impactful communication to your healthcare decision makers. This will support the process of getting their approval, and it will facilitate your journey to obtain the funding necessary to implement your development program. Let's partner together to inform healthcare decision-makers about the value of optimizing stroke care and the meaningful benefits that can bring to your patients. Let's partner together to communicate with impact. Medtronic is your stroke care partner.